Well, it's my pleasure to be again with you today, this morning, once again, with data that slowly continues to improve, thanks to the incredible work that everyone's doing here in Palm Beach County. This is a different graph, image that I thought I'd bring to you instead of our regular graph, which continues to go down. But it shows you state by state the number of cases in the last 7 days and by the territories. So you can see that Florida is in the second. We're not in the dark blue, that's Texas, Michigan, Ohio, Pennsylvania, and then, but instead, we're down to the medium blue with Florida, Georgia, Tennessee, North Carolina, Virginia, and then some more states across Colorado, Arizona, California, and Washington. So it's good to be in that second line. But most exciting now that we actually are seeing some light green in Vermont, Hawaii, Puerto Rico, the District of Columbia, and all our territories are in that light yellow, light green color. So that means we're making progress. And we're also, this graph now shows our vaccinations. And you can see the ups and downs that we've had. Starting, this graph is too small for you to see it all the way up there, but it starts on the 12/14, so in December of 20, when we first started with the vaccinations. And you see how quickly that graph went up. And then as the vaccine became available to all the 65 and over, then it slowly started going down until we added the other ages that made little spikes go up. And this is when they included the children down to below 12. So you can see that we've had a little bit of slowing and a little bit of, lastly, in October, we've had another small peak going up. So the message is getting out to folks to get vaccinated. In the U.S. right now, we have at least 77% of the population has at least one dose. And for fully vaccinated, it's 66.7. So we're getting there slowly. And of course, the the Delta virus is the one that's making this harder to do. You can see that it now is 99.9%. So basically, for all practical purposes, it's the Delta that remains really strong, it's more contagious, and it creates those breakthrough cases that we're seeing. This graph here just shows our new cases per week. I just made reference so that you can see that this is where we were at our lowest point, was in the middle of June. On actually the 11th, we had only 660 cases per week. That was the lowest we've been. And we also had a positivity of 2.9, and the only reason that kept us in the moderate and didn't go all the way to blue was because we had 44 cases per 100,000 in terms of population. So that stopped us from being able to actually be all the way down to low transmission risk. So we climbed quickly, and now we're coming down. So I put that little blue line there, the 1,744, that was at our last board meeting, and now we're down to 1,430 cases per week, which is keeping our contact tracers much happier than we were at 9,000 at the peak. This is our numbers for our report that comes out on Friday. And you can see that we're at 4.1% new case positivity rate, and we're at 96.2 for the 100 cases per 1,000. At our last commission meeting, we were at 6.5 and 162.6 cases per 100 population. So we have dropped 66.4% cases, and 2.4% positivity we have dropped in terms of the new case positivity. So we're well on our way to continue to go down. Our total vaccination right now is 75. That went up by 1 point. This is the measurement and how the CDC determines what levels the counties and the states are at. So Florida has dropped to substantial, just as our county here has dropped. And so we are at substantial because our positivity is in the blue range, right here. We're at 5%, so we've fallen low for the positivity, but with the 92 that we're at, we fall in substantial. So that's why we've turned orange. So we have to get below 50 to go to moderate, where we were in June, and then we have to go below 10 to be able to turn blue. That's the goal. So this is how we look in terms of the state. You can see that we are now the only counties that are still in the red. Glades actually went up right here. They were actually in orange. Now they went back up to red. This is Henry. This is Dade, Hillsborough. And orange is also in moderate. So Orange and Palm Beach County are the two metros that have gone down to substantial, and Miami, Hillsborough are in the red still. So that's very encouraging, and we actually see that some counties actually have turned to moderate. So we're on our way to looking like we did back in June. This is just a graph showing the ages, and we see that slowly these numbers are going up. We still have a way to go before this group here gets above the 80%. That's why we want to put all these people up here. In terms of our monoclonal, I know I've had many questions about that. We have really been decreasing the number of people that we're seeing for the past 2 days. The 13th and the 14th, we only saw in the 30s. On October 12th, we dropped down to 42. We had been in the 50s and 60s. So dropping that low, there have been no conversations of closing this down yet, but it is thought, and we have to consider that if this continues to go low, that these numbers can definitely be absorbed locally, as opposed to having this setup that they have with all these teams at our 24 sites now. They dropped by one. I forgot to update this slide. There's only 25 sites across the Florida now. So we'll continue to monitor that, but the total number of people who have received monoclonal therapy in Florida is 139,385. So those are all people that have been saved from going to the hospital and from dying from COVID. So the boosters, that continues to be something that's difficult for people to understand. The FDA has given approval for Moderna for the boosters. However, the product is not out yet, as far as I know. I don't know if it's being made available. The dose in the bottle is half the strength of the original vaccine. So therefore, that supply has to get out to the pharmacies and to the vendors. So if you do not fall in the category for the Pfizer booster, you have to ask for a third dose. If you ask for the booster from Moderna, you will not get it. They will tell you we don't have that shipment yet. So use your language correctly. If you're immunosuppressed, you can ask for both Pfizer and for Moderna third dose. Those who are over 65 who took Pfizer, and all those in those age 18 and above who live in long-term care facilities, have underlying medical conditions, which, by the way, are going to be included with all these for the third dose. It includes organ transplants, HIV/AIDS, actively on chemotherapy, and taking immunosuppressant medications. And many other underlying medical conditions are all listed for you to be able to get that booster for Pfizer. But right now, if you don't, then you gotta ask for that third dose. Also, anybody in the high-risk settings who either work or live in those areas. So that includes congregate living, corrections, it includes fire rescue, it includes paramedics, teachers, all staff at schools, people who are working in grocery stores, people who drive commercial vehicles with people in them, includes bus drivers. It includes a lot of people who are in contact with public in large numbers. All those people can get the booster for Pfizer right now. And so our mitigation strategies are going to continue pretty much the same as we have been. We still realize we have to really be careful with this Delta. It continues to be very contagious and causing the outbreaks that we are seeing. The vaccination remains the most important tool to stop the spread and save lives. The hospitalizations have decreased. I calculated the predominant unvaccinated patients now is 77%, went down from 84, and we had no adults, no pediatric patients in the ICU, with only 101 adults having been admitted, and only one child being admitted, and none of the children had gone to the ICU. So we need to prepare for a winter spike. We can't let our guard down yet. We need to continue to be cautious, watch our distance, wash our hands, but we also need to hopefully get to moderate so that it goes down enough so that when we do spike, it goes up just a little bit. I am optimistic that because of all the vaccinations that we have done, that we won't see the big spike that we saw in July going really, really high and putting the surge on the hospitals. So we're going to keep an eye on that. We've been constantly talking to the hospitals, making sure they're okay. And so my final word is, please, if you have not gotten vaccinated yet, please do so. It definitely saves lives, and we need all the immunity in the community possible so we can get through winter.